First, I'm going to inspect her skin. It is warm to touch. It is moist. She has good turgor. There are no lesions noted or no problems reported. Her nail beds are pink, rounded. There's no clubbing, and she has the cap refill is 1 second. Her hair is soft and curly. It is evenly distributed. There are no scalp lesions noted. You also need to make sure that you do a self-exam once monthly, okay? So we're going to teach how to do that. Okay. Her size, or her skull is normocephalic. She has no lesions noted on her skull. There are no tenderness or deformities. And we're going to palpate the temporal artery and the temporal mandibular joint. Can you open your mouth for me? Okay. Her facial expression is happy. She's smiling as we're talking. She has symmetry to her face. There's no abnormal muscle movements. There's no lesions, edema noted. Okay, we need to check your vision now. Can you come over here and stand for me? We're going to say she's 20 feet away, and we need you to read cover your right eye and read line number. Read this line for me.
DEFPOTEC.
Now cover your other eye. Read the same line.
DEFPOTEC.
Okay. Now with both eyes, read that line.
DEFPOTEC.
Okay, she has 20/20 vision in both her eyes with glasses. So hop back up on the bed for me. Okay, now we're going to do the confrontation test, so I need you to cover your right eye. All right. Now when you see my fingers, I need you to say now.
Now.
Okay. Now let's switch sides, cover your opposite eye. And when you see my fingers, say now.
Now.
Okay, good. All right, we're going to check for corneal light reflex. So just look ahead. That is normal. We also want to do the cover test. I need you to stare at a point against the wall. I'm going to cover your eye. And that is normal. Continue to stare at that point. And her pupils both react normally. Now, I need you to leave your head still and just follow my fingers with just your eyes only. This is the 6 cardinal points of gaze. Eyes again. Good job. And that is normal as well. Her eyes are normal. They're symmetric. Eyebrows and eyelashes are normal and evenly distributed. There's no lesions noted on her eyes, or her eyelids, I'm sorry. Her eyeballs have normal alignment. Can you take your glasses off for me just a minute? Her sclera is white and conjunctiva is pink, and lacrimal apparatus is normal. Okay, just leave your glasses off for me for just a minute. Okay, now we're going to check the anterior eyeball. The cornea and lens is smooth and clear. We're going to check her iris is normal. Her pupils are about 2 millimeters, round, and both reactive to light. Now we would check the ocular fundus. So we would check the optic disc, the color, shape, and margins. And it should be creamy yellow, round, oval, and regular. We would also check the cup disc ratio. Next we would check the retinal vessels, number, color, AV ratio, caliber, and AV crossings. So we would check both of those. There are no tortuosities or pulsations noted. The general background of her eye is, with the color integrity is light red to brown. And we would also check the macula. We're going to move on to the ears now, okay? Her external ear is normal in size. There are no lesions noted, no drainage. The auricles are positioned normally on her head and they're symmetrical. I'm gonna look inside your ear. This tympanic membrane is gray and flat and intact. This tympanic membrane is gray, flat, and intact as well. The external auditory meatus is normal in size, and there's no swelling noted. And both ears again have normal alignment. I need you to tell me if you can hear me when I whisper to you, okay?
Yeah. Yeah.
Okay. She does pass the whisper test and seems to be able to conversate and hear me well. Next, we would also, if we had a tuning fork, we would do the Weber and Rhine test. Next, we're going to inspect her nose. It seems normal and symmetrical to look at it. Do you have any tenderness of your nose?
No.
No tenderness noted. I need you to breathe in. Breathe in. Both nares are patent. Okay, I'm also going to inspect the inside of the nose. And palpate the sinuses. So everything so far, mucosa in her nose is pink and dry. I'm going to palpate the frontal and maxillary sinuses. You tell me if you have any tenderness. Any tenderness there?
No.
Any tenderness there?
No.
Okay. Okay, her lips are intact. They're moist. Open your mouth for me. Let me see your teeth. Her teeth are free of debris and white. Now, just open your mouth a little wider for me. The buccal mucosa is moist and pink. Can you stick out your tongue? Okay, like that? Okay, good. Tongue is intact, no swelling or edema noted. Her gums look good as well, no lesions noted. Now I'm going to look inside your mouth, okay? We're going to check your tonsils. So I need you to say ah for me.
Ah.
Her uvula is intact. Her tonsils are a grade 1 and no other lesions noted. We would also look for the Stenson's and Wharton's duct. Okay, I need you to move your neck from side to side and back and down. She has normal range of motion of her neck. There's no lesions noted, and it is symmetrical. Now we're going to check her lymphatics. We're first going to check the pre-auricular, post-auricular, the occipital, the segmental, the submandibular, the jugulo-digastric, the superior clavicular, the deep clavicular, posterior, I'm saying that wrong. I'm sorry, we would check the superficial cervical, the deep cervical, the posterior cervical, and then the subclavicular. We're going to check her trachea. It is midline. Her thyroid, I'm going to palpate it. It is palpable and there is no enlargement noted. We would also next check for thyroid bruit. And there is none noted. That is all. Thank you.